Hi, I'll be conducting your interview today. Can you state your name for the record?
My name is Empress McNeil.
All right, so let's just dive on in. Tell me about a time in clinicals at FTCC in which you delivered high quality, patient centered care to individuals, families, groups, and communities in varied settings.
During my 212 rotation, I had 4 patients, and it gave me the opportunity to work with different patients of many age groups. And I made sure I did focus centered care for each patient, and I made sure that each of their individual needs were met. I started with an assessment, and then I followed with um, medications that were appropriate for them. I followed also with teaching, and I just made sure every patient what needs was met on an individual basis. And so yeah, I've had the opportunity to work with different age groups, and it and had the opportunity to implement care with each patient during my clinical rotation at FTCC.
Wonderful. All right, tell me how you use something to learn from one of your class assignments to incorporate best practice and professional values and standards into compassionate nursing practice.
One of my class assignments, we focused heavily on fluid overload. So I had a patient who had a diagnosis of chronic heart failure, and they were asking about having some fluids. And I knew from reading the patient's health records that they had a diagnosis of chronic heart failure. So before I could ever even think about getting the patient something to drink, I went to my nurse and I spoke to them about the restrictions, the fluid restrictions, and then I then followed up with my patient to let them know so that I can make sure that they were safe, and that is the most important thing, is making sure that, I'm not doing anything that would be a detriment to their health and safety.
Excellent. Tell me an example of how you have demonstrated cultural and global congruency in the healthcare environment with diverse populations in promotion of healthy lifestyles and preventative health screenings and clinicals at FTCC.
I had a patient who there was a language barrier. They didn't speak English. They actually spoke another language. They were Hispanic culturally, and I was able to use the translator phone to communicate with that patient and let them know that I was going to be performing a glucose needle stick on them to see what levels of glucose they had in their blood. So after explaining to the patient, I felt as if they were more prepared and they understood better on what it was that I was doing, because I don't ever want to do any procedure on a patient and them not actually know what the purpose is. So that's how I used culturally congruent um, care for my patient.
Wonderful. We love to have great communication with our patients here at our hospital. So I appreciate your answer. Describe a situation in SIM or clinicals at FTCC where you function as an effective member of the healthcare team, demonstrating excellent interprofessional collaboration.
During simulation, we had a sim where we were dealing with a deteriorating client, and my role was to be the recorder, and I made sure that all of the information that was being communicated during the sim was being thoroughly documented, and that later on, if that information was needed, that I had everything that was documented precise and correctly. And I just made sure that I played my role as recorder. I played my role to make sure that we were making sure that the patient remained stable. And so I just felt like we worked together as a team to help the patients. So.
Great. Sorry, one sec. All right. Describe how you have demonstrated beginning skills in points of care leadership, management, and care coordination using effective communication skills through either successful completion of a class project or a clinical situation or experience.
During my Nurse 212, we had a group project where we were dealing with sickle cell anemia, and just problematic areas when it comes to appropriate pain management. And we all worked together. We split up our roles, but even though we all had individual roles, we worked together as a team, and we met up for appropriate times. We shared information. If any of us had questions, we didn't want to make them feel like they were silly questions. We answered the questions. We followed up with, just the work that we were doing. And we worked together great as a team. And I feel like, team leadership is most important, but it's also important to have teamwork. So I was able to be a part of the team, and we did excellent on the project.
Excellent. All right. As you know, conflict can arise. So, can you describe a situation where you had conflict with another individual and how you dealt with it? What was the outcome? How did you feel about it?
Okay. During one of my rotations, I had a patient that was needed to be administered insulin, and we drew up the insulin and we checked to make sure it was drawn up appropriately. And when I was about to administer the insulin to the patient had shared to me that they were not fond of letting a student administer the medication. So although they said it in a very dramatic way, they were kind of like upset. I made sure to let the patient know that they had the autonomy to be able to make that decision, and I respected their wishes. And my instructor administered the insulin, but I know how important it is for a patient to feel like they are heard. So I just took that as a learning experience, and I just respect my patient more for that, for being able to voice how they feel, and I felt it made me stronger as an aspiring nurse.
Tell me about a time you received negative feedback on your performance in class, lab, or clinical, and what did you do about it?
I was told during one of my clinical rotations, that I didn't exude enough confidence. And my clinical instructor told me that I knew a lot of information and that I was very informed when it came to implementing work. But I just needed to be more confident, because I know that confidence is key. And if the patient can see that you're not confident in what you do, then they don't feel comfortable with the care that you're supposed to provide. So I took those words of advice, and I thought about my strong suits. I thought about ways that I could better propel myself into being more confident and just doing better. And I felt it made me stronger in the long run, and I feel that I have more confidence after assessing and being able to understand that I'm growing. I'm growing as a nurse. I'm growing as a student, and I just take it in strides, and I understand that, growth is inevitable, especially if you want it to be. So in order for you to be a good nurse, you have to believe it yourself.
Those are some great words. How do you prioritize projects and tasks when scheduling your time? Give me some examples.
I make sure I study every day. Even if it's just 30 minutes to an hour, I make sure I study. And then with tasks that I know, like assignments that are like a big assignment, I'll break it up. I'll do like half of it one day and then half of it the next day, so that I don't feel overwhelmed with doing the work. And I feel that if I do like work one day and I go back and see it, it gives me a different view or a different perspective of the work, and I'm able to perfect what it was that I did previously. So I try to work every day on my work, and I study at least an hour daily, and I try not to procrastinate.
Describe a situation where you recognized a safety concern. What was it? What did you do? And what was the result?
I had a patient that was prescribed a BiPAP machine because of, I think they had like COPD. So my patient felt more comfortable with taking off the BiPAP machine, but when I was taking vitals, I was noticing that the fluctuation of the oxygenation and respiration rate was declining. So I took that time to educate the patient and let them know that it's better to use the machine because you don't want further damage with your lungs. You don't want to be mechanically ventilated. And I just, after explaining and teaching the patient, what could happen, what would be the outcome if they didn't follow their oxygen regimen, the patient really started wearing the mask, and I felt like I helped them. So,
Sorry about my phone. Give me an example of methods you use to build rapport with your patients and peers.
okay, so I use open-ended questions when I ask questions, just to make sure the patient understands what it is that I'm trying to let them know. So I try to use therapeutic communication. I ask the patients about themselves, their likes, their dislikes. I just leave room for asking them, for them to ask questions and be able to be that beacon of answers for them. I always ask them about their family, and I talk about things that I feel like they'll relate to. So I feel like I have a good rapport with my patient because I just want them to feel comfortable.
All right. And as all great things come to end, I have one last question for you.
All right.
Tell me about a situation where honesty and integrity were used to promote patient advocacy and/or safety.
Okay, so my patient was telling me that they were going to cook a meal when they got discharged from the hospital, and I asked them what the meal was, and they told me it was like this high caloric, high sodium meal that they were talking about, and I knew that patient was on dietary restrictions of sodium, and they had uncontrolled hypertension and things. And although I didn't tell the patient that it was the wrong thing for them to cook, I did let them know that, sodium needed to be restricted in a way where maybe this would be more appropriate instead of frying this. Maybe they should bake this. Just a different method of cooking so that it'll be more nutritionally dense for them. Instead of further messing with their blood pressure. I just felt like me giving them that little bit of education gave them the option to know that no, you don't have to not eat the meal that you choose, but you can make it better for yourself. So I was being honest with them. So
Well, thank you for your time. We like what we hear, and we'll be contacting you shortly.
thank you so much.
All right.